Bladder cancer is the sixth most common cancer in the U.S. Men get it more often than women, but a viewer named Catherine says any notion that it's, quote, an old man's disease is false. She wrote us over the weekend saying she's been dealing with bladder cancer since October 2021. She calls herself fortunate to be diagnosed early due to other circumstances, but she says the more she learns, the more she realizes women are not being listened to when they tell about their symptoms. We shared Catherine's note with our 9 News medical expert, Dr. Payal Kohli, who joins us this morning to talk more about bladder cancer in women. Thanks for coming in.
Good morning, Corey.
This is a topic that hits close to home for me. I have a family member, a female, who also had bladder cancer, so I'm so glad that we're talking about it. Is Catherine right? Why is there a disparity between men and women when it comes to bladder cancer?
You know, Catherine is right. We sort of think of it as an old man's disease, but actually 1 out of 4 bladder cancers are in women. And it can happen really at any stage of a woman's life. So even young women can get bladder cancer. But here's what Catherine really points to, which is so true, is that a lot of times women ignore the most common symptom of bladder cancer, which is blood in the urine. And if you think about why that might be, it's because we menstruate, right? We have postmenopausal bleeding, we can have bladder infections, we can often confuse the symptom as a sign of something else. And even after we point it out to our doctors, many of them sort of think it's one of those other diagnoses rather than bladder cancer.
So what do women need to know about bladder cancer?
You know, they're getting diagnosed at a much later stage, which can obviously significantly affect the prognosis of the condition. They need to know that the symptoms can very much mimic the symptoms of a bladder infection. And sometimes the two can occur together. So if a woman has a bladder infection but also has an underlying bladder cancer, you have to pay attention because it may not clear with antibiotics. So if that burning, frequent urination, blood in the urine, whether it's microscopic or macroscopic, like a dark orange kind of colored urine, don't ignore it if it doesn't clear after antibiotic treatment. And unfortunately, Corey, bladder cancer is one of those cancers that has a really high rate of recurrence. So 50 to 80% of them will recur. And this has a significant impact on women because if they're getting diagnosed later, the chance that they're going to lose their bladder and the chance that it's going to recur are significantly higher.
It's so scary. What are risk factors for bladder cancer?
You know, the most common one we think of is really cigarette smoking. And so essentially what happens when you inhale the cigarette smoke, all those toxins get into your bloodstream. Then that blood gets filtered by the kidneys, and so they essentially get concentrated into the bladder itself. And when they're sitting in the bladder, they're exposing the inside of the bladder to all those carcinogens, and that's how you develop it. But we're learning that it can be other types of toxins as well. So arsenic in our water, it can be exposure to some metals or paints or lead type of toxins as well. Some Chinese herbs can do it. Obviously, having a family history can also be a significant risk factor. And certain types of infections, parasitic infections in the bladder can also set you up to have irritation and bladder cancer.
Does holding your bladder contribute to that, or does it have nothing to do with it?
Yeah, you know, that's a question that people often ask. Holding your pee is a terrible idea because it affects the muscle, but the bladder is a muscle in many different ways. It can weaken the muscle, so it can stretch it out like a water balloon, actually cause problems with incontinence later in life, and it can create urinary tract infections as well. Now, if you have higher exposure to toxins in general, doing something like that can also potentially increase the exposure to toxins, but really not so much cancer, more infections. But recurrent infections cause injury to the inside of the bladder, and that can certainly set you up as well.
Well, we appreciate Kathleen writing into us. It's really an important topic, and thank you so much for coming in. You got to be your own advocate. If you know something's off, you know, just push through. Thanks so much for coming in.